We're joined now by Vermont Senator Bernie Sanders, who is in Burlington this morning. Senator Sanders, House Speaker Paul Ryan thinks that his legislation can get 51 votes in the Senate. What do you think?
Well, I sure hope not, John. It is an absolute disaster. It is a disgrace. And by the way, this really has nothing to do with health care. What this has everything to do with is a massive shift of wealth from working people and middle-income people to the very richest people in this country. It is a $275 billion tax break for the top 2%. Millionaires will get about $50,000 a year in tax breaks, while at the same time, some 5 to 10 million people are going to lose their health insurance. Premiums are going to soar. The AARP says that if you are 64 years of age and you're making about $25,000 a year, you're going to pay up to $7,000 more for your health insurance. They're going to defund Planned Parenthood, deny over 2 million women the right to choose the health care that they need. They're going to decimate Medicaid, which is why the American Medical Association, the AMA, and the American Hospital Association oppose it in addition to the AARP. This is a disgrace. And by the way, they are so cowardly that they want to go forward before the CBO even gives an estimate as to what it will cost and how many people will lose their insurance.
Well, a lot of charges there. The Speaker says the CBO will be giving, the accountants in Congress will be giving their score on Monday, so it will be able to be a part of the debate. But let me ask you this question about how many people will lose coverage. What Speaker Ryan says is it's an unfair comparison because the people who have coverage now have coverage in a rickety system that is getting worse. Premiums are going up. Insurance companies are dropping out of the system. So it's unfair to compare the people who have it now because the system's falling apart.
Oh, really? Well, 5 to 10 million people are going to have no health insurance at all. Nobody has ever suggested that the Affordable Care Act, Obamacare, was perfect. But it did put 20 million people into the ranks of the insured. In my view, and what the American people want is an improvement on Obamacare, not the decimation of Obamacare and throwing so many people off of health insurance and raising premiums substantially. It is very hard for Ryan or anybody else not to deny that what they are bringing forth is far, far, far worse than Obamacare, and that its primary purpose is massive tax breaks for the very wealthiest people in this country.
There's been a lot of criticism from some senators about what the House is putting together. I wonder if you see an opportunity to use the opposition against the House bill to do something that's closer to what you want.
Well, John, that is a very fair question. But as I understand it, this bill is so outrageous that not only have the Republicans moved forward in the House without the CBO score, they want to move forward in the Senate without any hearings whatsoever. If you realize this bill is going to impact tens and tens of millions of people, and to the best of my knowledge, they want to bring it right to the floor of the Senate. I'm a member of the Health Education Committee. When Obamacare was being debated, we had hearing after hearing, meeting after meeting. It never ended. And these guys want to take a bill so significant to so many people and just shove it through because they don't have the guts to hold hearings. They don't want the American people to know what's going on.
They say that there will be a multi-step process here. This is one step, and then there will be future legislation. So what you might want would be in that future legislation, which would also have a 60-vote threshold. This one has only a 50-vote threshold because of the way it's going through.
Well, they could say what they want, John, but it is impossible for any serious legislator to defend a process by which a bill is coming to the Senate without one hearing before the vote takes place. And I think it's clear to everybody. They want to move as quickly as they can. They are embarrassed about the product. And let's not forget that President Trump, who now I guess today at least supports it, we don't know what he will say tomorrow, but Trump was the guy who said to the American people when he ran for president, oh, don't worry, we got a terrific idea. We're going to provide health care to all people. Well, this is far from it. This is throwing 5 to 10 million people off of the health insurance they currently have.
All right, Senator Sanders, we're going to have to leave it there. Thanks so much for being with us.
Thank you.
Mr. President, last week, Republicans in the House released a bill to repeal the Affordable Care Act and cut Medicaid to the bone. On Tuesday, the Congressional Budget Office, those are the independent budget experts who analyze policies under consideration here in Congress, estimated that the plan would rip health insurance coverage away from 24 million Americans and cut $880 billion from the Medicaid program. And as a bonus, the plan provides hundreds of billions of dollars in tax breaks for the rich. Who comes up with a plan like this? What kind of health care bill has as its central feature ripping away health insurance from tens of millions of American citizens? What kind of politician thinks that they were sent to Congress to destroy the financial stability of millions of middle-class families and give wealthy donors a tax break that they certainly don't need? Who thinks that the central problem in America is that middle-class families have too much health care coverage and that the richest people in America need government to hand them more money? There is no other way to say it. This bill is just part of a Republican plan to help the rich get richer and kick dirt in everyone else's face. This bill is an economic disaster, and at its center, it is cruel. Cancer survivors losing coverage, seniors facing premium increases of $12,000 a year, people with disabilities forced into nursing homes. And one of the cruelest things is what this bill will do to individuals, to families, and to communities struggling with the opioid crisis. Last year in Massachusetts, nearly 2,000 people died from opioid use. That is more than double the number who died in 2013. That's right, double. Between 2014 and 2015, Massachusetts had a bigger jump in its death rate from drug overdoses than any other state except North Dakota. Now, last week, I was on the front lines in Lynn Community Health Center, where dedicated staffers are trying to meet this opioid epidemic head on. This week, I went to Manic Community Health Center, where a coordinated team in Quincy is battling the opioid crisis. But while I was there, I not only met with the professionals, I saw the mamas and the babies, the people who are in recovery, and people who reach out to those who are still in the grip of drugs. The opioid crisis isn't happening to someone else's family or in someone else's community. It's happening to our families in our communities. And we need to do more to stop this plague before it takes another of our loved ones. We need to do more. What we absolutely cannot do is less. We cannot take away the resources already committed to fighting the opioid crisis so that some millionaire can get a tax break. Current law, the ACA, requires all insurance plans to cover substance use disorder treatment and prevention as an essential health benefit. That means that your insurance company can't turn off your access to treatment just when you need it most by saying, oh, sorry, we just don't cover that. Current law, the ACA, gave people the chance to get that insurance. Through health exchanges and subsidies, millions more people got private insurance. And through Medicaid expansion, millions more were covered by Medicaid. So there it is, our first line in the defense in the war on opioid addiction. The ACA currently means that more people are covered and that coverage includes substance abuse treatment. And what does a Republican plan do? Take away coverage for 24 million people. That's 24 million people who no longer have any access to substance use disorder and prevention services. And then they want to let insurance companies jack up the out-of-pocket costs for substance abuse programs and mental health programs. In fact, some Medicaid plans would be able to drop this coverage altogether. So millions more people would lose their one lifeline if someone in their family is taken by drugs. Now, don't get me wrong. What we're doing right now is not enough. Even now, only 10% of those who need treatment for substance abuse disorder receive it. 90% already can't get help. But that means we need more, not less, help. Repealing the protections for mental health and substance use disorders in the ACA would yank more than $5 billion, that's $5 billion in actual funding that is currently going to mental health and treatment services. That's the Republican plan to deal with the opioid crisis. Ask any family trying to get treatment for a loved one who is addicted to drugs. We already have an opioid treatment gap. Gutting the ACA is like shoving a stick of dynamite into the treatment gap and then lighting the fuse. And if the Republicans get their way, people will lose health coverage. People will lose access to recovery services. People will die. Now is the time to stop this cruel bill in its tracks before it hurts real people. Now is the time to speak out about the importance of the ACA and Medicaid to you and to your family. If you or someone you know has been touched by the opioid epidemic, you know how much this matters. Maybe you have a sister or a child or a church member or a high school friend who has struggled with substance use disorder. Maybe you know someone who has fought on the front lines of this crisis as a healthcare provider, as a community advocate, as a first responder. If you do, then you know the stakes in this debate over the ACA and Medicaid. Now is the time to act. Don't wait. If the Republicans end up destroying help for millions of people, don't wake up the next morning and wonder if you could have said more or if you could have raised your voice back when it mattered. No, the Republicans are trying to pass this terrible health care bill now, and now is the time to speak out. It is time to stand up and to tell Republicans to end their cruel health care plan. Our families and our communities are counting on us, and we cannot let them down. Please speak out. Thank you, Mr. President. I yield.